Picture this. It's 6 a.m. at a prestigious medical school. A student deliberately gives her classmate the wrong location for a mandatory lecture, hoping she'll be marked absent. Another student takes credit for a peer's clinical reasoning in front of an attending. A third erases helpful notes from a shared whiteboard before the next student's turn. These aren't isolated incidents, they're symptoms of a psychological pathology that's infected medical school education. Today, I want to examine the competitive mindset that's systematically destroying the very people we're training to be healers. My name is Christopher Schorr, and I'm a fifth year MD PhD student at Indiana University School of Medicine and Purdue University Biomedical Engineering. What I'm about to share isn't comfortable, but I believe it's necessary. Let me present you with some data that should disturb you. Research shows that up to 58% of medical students admit to cheating during medical training. In competitive medical environments, 87% of first-year students experience high levels of imposter syndrome. Burnout rates among medical students reach upwards of 60%, with over 20% experience depression. But here's what's more concerning. These aren't accidents. They're predictable outcomes of a system designed around a fundamentally flawed psychological premise. The competitive mindset operates on scarcity thinking. It assumes that for me to succeed, you must fail. It transforms learning, which should be collaborative and generative, into a zero-sum game where knowledge becomes hoarded, peers become threats, and helping others becomes strategic weakness. This isn't just psychological problematic, it's clinically destructive. When we condition future physicians to view their colleagues as competitors rather than collaborators, we're programming them for failure in the very environment where they practice medicine as a team. From a psychological perspective, competition and inspiration operate through entirely different cognitive and emotional pathways. Competition is hierarchical. It requires an other to dominate or surpass. The competitive mind asks, how can I be better than them? This creates what psychologists call an external locus of control. Your sense of worth becomes dependent on the comparison and relative positioning you have. Competition also activates threat detection systems in the brain. When you're competing, you're constantly scanning for threats to your position, which maintains chronic stress activation. This isn't optimal for learning or creative problem solving. Inspiration, by contrast, is non-hierarchical. It doesn't require anyone to lose for you to win. The inspired mind asks, how can I become more like the best version of myself? This creates an internal locus of control. Your growth becomes self-directed and sustainable. Here's the crucial difference. Inspiration allows you to celebrate others' success because it doesn't threaten your own progress. In fact, others' excellence can fuel your own development. When you're inspired by someone, their continued success gives you more to learn from, not more to fear. The research on this is overwhelming. Studies consistently show that interprofessional collaborative education leads to better patient outcomes, reduced medical errors, and improved clinical decision making. In one study, implementing collaborative care models in ambulatory settings resulted in a 48% reduction in patient costs, significant decrease in emergency room visits and hospitalizations, and notably improved staff satisfaction. But perhaps most telling, medical schools have reformed their competitive cultures, report not just better academic outcomes, but reduced student burnout, decreased substance use, and improved mental health. Here's why this happens. Medicine is inherently a team sport. When you're treating a complex patient, you need seamless collaboration between physicians, nurses, pharmacists, social workers, and other specialists. If medical students spend 4 years learning to sabotage their peers, we're training them for the exact opposite of what they'll need to succeed professionally. The gunner culture, students who undermine others to advance themselves, isn't preparing future physicians for excellence. It's programming them for dysfunction in precisely the collaborative environment where they'll spend their careers. Let me share what this looks like in practice. During clinical rotations, I've witnessed medical students racing to answer questions before their peers, not to demonstrate knowledge, but rather to prevent others from demonstrating theirs. I've seen students withhold useful study materials and resources from classmates, I've watched brilliant minds become so focused on outperforming their peers that they forgot why they even entered medicine in the first place. One particularly disturbing example, a student on rotation deliberately provided incorrect information to a classmate about a patient case, hoping the classmate would look unprepared during rounds. This behavior wasn't just ethically problematic, it directly compromised patient care. But here's what's most tragic. These students aren't inherently malicious. They're responding rationally to an incentive structure that rewards individual achievement over collaborative excellence. The psychology is clear here. When you create systems that pit learners against other, you don't get better learners. You get learners who become skilled at undermining others, the exact opposite of what you want in healthcare professionals. So, what does the alternative look like? Instead of asking, how can I outperform my classmates, ask, how can I become worthy of the responsibility I'm seeking? When you encounter a brilliant physician, don't compete with them. Learn from them. Study their decision making process, their patient communication style, their clinical reasoning. Let their excellence inspire your own development. This isn't just feel good philosophy, it's strategic psychology. When you're inspired rather than competitive, you can appreciate excellence wherever you find it without feeling threatened. This dramatically expands your learning opportunities. Medical schools have embraced collaborative models, report something fascinating. Students actually achieve higher academic performance when they're not competing against each other, when you're not wasting the cognitive resources on social comparison and competitive positioning. You can dedicate that mental energy to mastering the material. So, here's my challenge to anyone that's in the medical field or in medical training: choose inspiration over competition. When you see someone excel, don't ask, how can I beat them? Ask, what can I learn from them? When a colleague succeeds, don't see it as a threat to your own potential, see it as evidence of what's possible. This isn't just about being soft or non ambitious, it's about being strategically intelligent. The competitive mindset makes you fragile, dependent on others' failures for your sense of self and success. The inspiration mindset, however, makes you anti fragile, capable of drawing strength from other people's experience and excellence. Medicine needs physicians who can collaborate, not competitors who happen to have medical degrees. The patients depending on us deserve healthcare providers who've learned to build each other up, not tear each other down. So, to conclude, I'll send you off with this: be inspired, not competitive. Your patient lives may depend on it. Thank you for watching.